Hey, Dental Fam, it's your girl Leela. Who else? And welcome back to
The DA Study Spot, yeah.
Today's study session is dental instruments and their uses. This is the stuff you will be responsible for every single day in that office. We're talking exam kits, restoration tools, extraction setups, all of it. So if you are studying for the DANB exam, go ahead and hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Let's start with the basics. Your examination kit, also known as the setup tray. This is what you will pull for every single patient, no matter the procedure. The first instrument is the mouth mirror, used for indirect vision, retraction, and light reflection. The next instrument is the explorer. That pointy hook, it's used to check for decay, margins, and calculus. Next instrument is the cotton pliers, used to place or remove small items like cotton pellets or wedges. And the last instrument in this setup is the periodontal probe, used to measure pocket depths in millimeters. Exam tip. On the DANB, they love to ask which instrument detects decay. The answer, the Explorer. Now for the fun stuff, restorative instruments. These instruments will be used when the dentist is doing fillings or crown preparation. First instrument is an amalgam carrier. This carries mixed amalgam to the prep. Next instrument is a condenser or plugger. This packs the amalgam into the cavity prep. Next is burnishers. This is to smooth the surface and shape the amalgam. Then we have carvers, which will be a Discoid-Cleoids or Hollenbacks, etc. They are used to carve anatomy and remove extra material. Lastly, composite instruments. These are non-stick tools used to place and shape composite resin. Tip: composite instruments are plastic or titanium coated so the material doesn't stick. Y'all still here? Next section is the hand cutting instruments. Before there were high-speed handpieces, we had hand cutting instruments, and you'll still see them used today. First instrument, the hatchet. This smooths walls and removes enamel. Then the chisel, which shapes enamel margins. The hoe planes the walls and floors of the prep. Then you have the GMT, the gingival margin trimmer. This cuts enamel and forms bevels on the gingival margin. Exam tip: remember, hatchets and chisels shape, hoes plane, GMT trims. Next up, section 4, extractions and surgical instruments. Extractions call for a whole different setup. Here's the most common tools you'll see in oral surgery. First, we have the elevators. These are used to loosen a tooth before extraction. Then you have your forceps. These actually remove the tooth from the socket. Then you have your surgical curette. This scrapes and cleans the socket after any extractions and get rid of any infections. Then you have your rongeur. This is used to trim bone. You have your bone file, which is used to smooth rough edges. Then your hemostat to grab tissue and small materials. And lastly, your scalpel handle with blade, which makes incisions. Tip: the DANB may show a photo and ask which instrument removes the tooth. Always look for forceps. And then the last section, section 5, accessory and lab instruments. These are the tools that support procedures. You'll have your articulating paper holder, which is used to check occlusion bite. Your spatula, which is used to mix materials like cement or alginate. A dappen dish. This holds materials during a procedure like bond and primer. Then you have your crown and bridge scissors. This is used to trim dental materials. Quick tip: accessory tools aren't always sterile, but must be disinfected between patients. All right, y'all, this is the end of this study session. But before you go, let's test your knowledge with the
Pop quiz.
Question 1. Which instrument is used to detect decay? Question 2. What does a condenser do? Question 3. What's the tool that loosens a tooth before extraction? The answers are number 1, explorer, number 2, packs or condenses amalgam, number 3, elevator. Did you get them all correct? Drop your score below and tell me which setup you would like to go over next. And if you found this video helpful, don't forget to like and share with your dental besties. But don't forget to subscribe, and I will see you at the next session. Bye!
The DA Study Spot, yeah.